and good evening. Welcome to the Health Desk. This is the real space for you. When we have a real conversation, of course we know your mental being, you know your well-being, unajua unaendeleaje kiafya. And that is why I make sure I bring you specialists, I bring you people who are well qualified in that area so that they can give you facts of what is happening. Usifanye tu decision pale ukijiambia unajua nilisoma mahali fulani 1 2 3. You know nowadays Dr. Google is ukifeel kitu you're rushing there to look what is happening nini and then you get more tension, you get more or wrong information, but this is where you get the real conversation and you get the real answers. And that is why I make sure every Friday to bring you the best of the best so that usikae pale bila kuwa na information. And this is that time I tell you, start sharing the link, start sharing the live so that people will get to know what is happening, how they get to know about it. Na utajua kuna wale wanaumia in silence, and it's not because they are ignorant, it's because maybe they fear, if I say or if I talk about this, how will people feel about me or how will people view me? And that is why I make sure nakuletea ndio hata ukitoka pale nje usifeel embarrassed talking about it, or actually umepitia hiyo situation, you can tell another lady friend of yours, useme nimekuwa kwa situation kama hii, what should I do? And you know what am I talking about today? We'll be talking about fibroids. What is fibroid, the causes of it, the symptoms of it, inapata kina nani? Juu kuna myths za watu wengine wanasema sijui watu fulani wapati, watu fulani wanapata, watu. That is why tuko hapa tujue ni nani anapata, nani hapati, ama inapata kila mtu, ama inaweza kupata pia wewe, or what are the chances, unaweza fanya nini kuizuia. So you stay there, keep the conversation going. You can call, you can text, you can SMS on 0711 176 006, and I'll be glad to ask those questions for you. But before we go on, I have a guest. I have CEO that is together with me today that will be answering all the questions. But before I continue, let me give her a chance to introduce herself, tell you where you can find her, na wanafanya nini na nini, so that ukiwa na kaishu useme nataka kuenda mahali fulani, you'll know where to go. Karibu sana.
Asante.
Can you introduce yourself?
Okay, I'm Karen Odongo, Clinical Officer HealthWave. Okay, we are located at Teachers and Gatehouse. We offer all services, outpatient, inpatient. We also offer maternity services and surgeries under SHA. We also use insurance like Britam, AAR, and Badview Insurance. Thank you.
Wow. So if uko karibu na Teachers, you know where to go to. We say don't assume it. Go there, know what is happening to your health. Unajua si lazima ukuwe mgonjwa ndio uende hospitali. Tumeagree paka hapo. We totally agree that you go get checked kila wakati. You know what is going on with your body, because we need you healthy. Because we know if you don't have health, that wealth you not get it. But before we start with the show, this is the chance for you to partner with Oracle TV. It is the best TV station. That is where we tell you ukitaka ile balanced diet meal. Hapa ndo tunakuletea kila kitu, physically, spiritually. We make sure that your emotions are well connected, mental you're well connected, and that is why you become in as a partner. You make sure that we run 24/7. Partnering is very simple. Just go to our paybill 171133 account is Oracle TV, and of course any amount that you feel I want to become a blessing to God, you feel mimi ndio wakati nataka nifanye moja mbili kwa kingdom ya Mungu, and you know I tell you, once you're giving, put a demand on it, kwa sababu wewe ndio unajua ile unataka. Maybe uko pale unataka mtoto wako akuwe daktari. This is the best time. Unasema wakati atakuwa akitaka kuandikwa kazi, God remember I supported that program, I did this and this. So, and God will surely come through for you. And of course, let us begin the conversation of today. And kama uko na swali pale, ama kama wewe ni mama unaumia, uko na unasikia, this is the time for you to ask that question. Usiwache ikae ndani yako kabisa na useme sitaiweka. Wacha uulize swali, kuna mwingine atakombolewa mahali. Daktari tuambie what is fibroids, kwa sababu watu wengi hawajui what is fibroids.
Okay, fibroids are non-cancerous tumors. They affect mostly 80% of women under the age of 50 years. That is when you are in reproductive age. Yes. So at what age exactly are you? Do you say under 50? So if this person, at what age uko sure naweza kuwa na fibroids, ama naweza shikwa na fibroids, ama kutoka 0 to 50? No, mostly you will find 30 to 40 years. Yes.
And what are the causes of fibroids?
Okay, the first cause is null parity. When I say null parity, I mean you take time to give birth. That is, you've reached 25, you've not given birth, so you'll find the uterus is empty, so you'll find the fibroids get chances. Yeah.
So that is the only cause?
No, we have we have you early, when you start your menses early, you know, fibroids are caused with hormones called estrogen and progesterone. So when you start your menses early, like let's say 10 years, you will find you will have a high risk of getting fibroids because the estrogen and the progesterone hormones are very high. Yes.
So somebody who is 10 years, when they start their menses, that is it's like ticking. They are supposed to be checked. Ama mzazi akiona mtoto wake ako 10 years and they have started their menses, is there a risk factor mzazi anafaa kuwa akianza kushtuka?
Not really. Yes.
Okay, another cause.
Okay. Where they say it's common in blacks than in whites. That is because we blacks took a lot of estrogen and progesterone hormones.
Okay.
Yes.
So blacks are at a high risk of getting fibroids. And many people say diet or lifestyle can cause someone to have fibroids. Is that true?
Yeah, it's true. Mostly those people who love eating red meat and hate vegetables, they are at high risk of getting the fibroids.
So meat, they should not take meat as much, ama they should include something else.
Okay, you take meat, yes, but at a lower proportion. You eat a lot of vegetables than meat. Yes.
And hormones and what are these called? Hormones and stress, can they also play a role in it?
Stress, not really, but hormones, yes. Because I've told you we have a progesterone and estrogen. They are the ones supporting the fibroids. When they're high, you will find these fibroids grow. Yes.
Okay, and what are the signs that somebody should look at so that they know that I might have fibroids?
Okay, we have a painful menstrual. You find when you are going in your menstrual periods, you'll find it's very painful. Alafu they are heavy. You find that you are supposed to go the normal cycle. Normal days it's between 1 to 7 days, but now you find it's more than 7 days. So you need to go see a doctor because you are not supposed to go more than 7 days. Yes, you'll find heavy menses, longer menses. Yes.
So that is the only sign that somebody should look up on?
No, we also have what we call dyspareunia, that is painful during sex. So you'll find when you are meeting with a partner, you'll find it's very painful. Yes. That's another sign you need to look at because you are not supposed to feel pain. Yes. Another thing, you have we have what we call frequent urination, of which you find yourself you just want to go and pee every time. Yes.
Okay. And of course, let's talk about periods. You say, how do periods affect menstruation? When you have those periods, kuna ule mwenye yake tusema ni baby per day, we are supposed to use like 3 pads. This person is using 5 or a whole. I've had a scenario when somebody is using a whole packet for a single day. Is that a sign this person might be having fibroids?
Not really. Okay, we also have people who have another condition which causes heavy menses, but yes, even fibroids, you can find you are using more than those 3 pads a day.
And is there any case that somebody has fibroids and they don't even know they do?
Yes, we have asymptomatic fibroids. You have fibroids, but you don't have any symptoms. But when you go do an ultrasound, you will find you have fibroids, but they are asymptomatic. Hazionekani. Yani huna hizo signs za heavy menses, painful menstruation, abdominal pain, back pain, you don't have.
But you have fibroids.
Yes.
So it is a good you can advise somebody they should be going to do an ultrasound check every time. So after how long? Because naweza enda kufanyiwa ultrasound one year, ama nikipigwa hii mwaka najiambia nilipatikana sina fibroids until forever.
Okay, I always advise you do checkups yearly. Yes, you do checkups yearly. It's good for your health.
And I've had scenarios of women who have fibroids. They have what is called swollen belly. Is that a real cause? Ama unakuta mwingine people are assuming this woman is pregnant, but in real sense they have fibroids. What causes that for their stomach to swell?
Okay, when fibroids occur in your uterus, they grow like a baby, like a fetus. So you'll find that's when your belly grows. People will think that you are pregnant, but you are not. That's because we have progesterone and estrogen, which supports pregnancy. They are also supporting these fibroids, and that's why you will find your belly growing bigger.
Okay, and they say when a baby is eating, I've had women who are pregnant and they are having fibroids. They say when the baby is eating, the fibroid is also eating. Can you explain your part here eating fibroids? How do fibroids eat? Okay,
for a pregnancy to grow, kuna hizo hormones za progesterone na estrogen. So they support the pregnancy, and even the fibroids depends on those hormones. And when you are pregnant, the hormones are very high. So when the hormones are very high, obvious, the fibroids will also grow because they depend on the hormones.
Okay, and does it cause infertility?
Yeah. Fibroids cause infertility, that it can make a person not to get pregnant. That is because the space where the fetus is supposed to implant itself, it's taken by the fibroids. Yes.
And when for kimungu too, this person gets pregnant and they have fibroids, can that fibroid affect the baby?
Yes. Mostly, yes, you can get pregnant with fibroids, but mostly you will find miscarriages most of the time. But if that uterus sustains the pregnancy, yes, the fibroids will grow and the fetus will also grow.
Oh, so they all grow together?
Yes.
And is it advisable for somebody who have seen and they've known that they have fibroids, can they try to remove the fibroids before conceiving?
Yes. If you are in reproductive age, we encourage for you to do what we call myomectomy. That is, they just remove the fibroids and leave you with your uterus. And we also have what we call hysterectomy, which they remove all the uterus. Yes, but mostly we advise people over 50, yani when you wamefika menopause.
Oh, so yes, the uterus itolewe kabisa.
Yeah, ama if you are contented, you don't want to get pregnant again, you can consider doing hysterectomy.
Okay, and how do we diagnose fibroids?
Okay, first with the symptoms, that is someone comes heavy menstrual, that painful, they have pain, lower back pain. Okay, alafu then we have that dyspareunia, painful during sex. You will send a person for ultrasound. Mostly we use ultrasound to diagnose
fibroids.
Yes.
And so hakuna test ingine apart from ultrasound that shows you this person is needing fibroids, or there are different tests?
Mostly we use primary, we use ultrasound for us to know that this person has fibroids. Yes.
And do all fibroids need treatment?
Yes.
All of them?
But when they are asymptomatic, we advise that person just to leave them. But when the fibroid is symptomatic, you're supposed to go and see a doctor.
Actually, before we go there, can you kindly tell us the types of fibroids that we have? Because what we want to fibroids is fibroids.
Okay, we have intramural fibroids. These are fibroids which occur in the uterine cavity. We have subserosal, they occur outside the uterus. Alafu we have pendiculated, which is they are supported by the stalk. Yes.
Okay. Since most of them are surgical, is there any way of treating these fibroids if it is non-surgical?
Okay, mostly we can't say fibroids is treated non-surgically. We only do conservative management. That is, if the person has come with the excessive bleeding, we will have to stop the bleeding. Yes.
Also, all of it is surgical.
Yes.
But you have to stop the bleeding first?
Yes, you stop the bleeding. If the patient is anemic, you give blood, then you can plan how to remove the fibroids.
You know, most people when they hear about surgery, kila mtu huwa anaogopa because ukisikia unasikia ni kisu inapita kwa mwili. What can you tell this woman? Maybe they know they have fibroids and that is the way they're supposed to go, but they fear. What can you tell them?
Okay, when you go to surgery, sio lazima utanini kila, yani kuna ile huwezi ogopa tu kisu. Because ukiangalia the complication of fibroids, utajipea hiyo moyo useme it's better I go for that surgery and I go back to my normal nini kukua sawa than ukae hapo alafu the fibroids ikufanya ukuwa anemic, of which when you are anemic you'll have to get blood.
Oh, fibroids can make you anemic?
Yes, because of the heavy menses. So itabidi ukuwa unapewa damu, unaona? Of which yes utakuja, we will stop the bleeding, but we will not be taking drugs za ku stop bleeding every time. So you'll have just to accept that lazima uende surgery zitolewe ndio urudi normal. Yes.
So the only way is surgery. So for a woman out there feeling like this is the end of me, it's not the end of the road, it is just tuweka jeni kama tuka kidonda kenye kakigwaruzo hivi kanapona. So you just go to the doctor, let them do their work, let them know that this is what you're supposed to do. Daktari, kuna myth yenye tunataka to clarify. There are people who say fibroids turn into cancer. Is that true?
Not really. Oh, when we started, I said fibroids are non-cancerous tumors, so they can't cause cancer. Yes.
So it's non-cancerous.
Yes.
Now, family planning methods, can they cause fibroids?
No. In fact, mostly family planning, there are some family planning methods which zina prevent the fibroids. Yes. Of which, kitu kama, when we say, there are some people unawaambia use the family planning to prevent the what? The fibroids. Kama uko na heavy bleeding, you can use a IUCD. We have a hormonal IUCD and ina prevent nini? The heavy bleeding. Yes. But it's not a permanent solution.
Oh, so I wanted to ask, can it actually be prevented, fibroids? Because most people maybe fear it. Are there ways of preventing you getting fibroids?
How you can prevent it? The first, I've told you nulliparity, when you take time to get pregnant. Yes.
So the key thing is mapema ndio best.
Yes, mapema ndio best.
That is and kuna chakula zenye mtu anaweza kula zimfanya zikuwe zinaongeza the risk of you getting those fibroids?
Just eating a balanced diet. You don't eat like I've told you, red meat. You don't eat more red meat. You just eat kidogo tu. Then you mix with veggies. Just eating a balanced diet.
Make sure you have a balanced diet meal. And yes. Is it genetic, by the way?
And watch your weight, yeah. It's not genetic really, but it runs through families. Either, let's say your sister had fibroids, you are at a higher risk to get the fibroids. Either your mom had fibroids, you are at a higher risk to get the fibroids.
Oh, it is not genetic, but
it runs. It runs in family.
So kama kwenyu kuna zile signs umeona kwa watu, ukiangalia unaangalia nani alikuwa nayo, it is good for you to go get checked. As always, I'll keep on reminding you, you're not going to get checked so that you can useme niko nayo, but you know your health is first thing for you to be mentally okay, mentally stable, and you know you cannot do anything at all anything if you're not sober upstairs. So make sure uko pale unaenda, usifeel uoga. Kama is your sister, is your cousin, is your wife, make sure you encourage them. Hata saa zingine waambie let us go together, let's go, acha nikupeleke uende uangaliwe, uone what is happening, if you're still okay ama kuko aje. And of course love yourself. Jipende. Even the Bible says love your neighbor as you love yourself. That means you love yourself first before loving your neighbor, kwa sababu kama haujui kujipenda hakuna venye utajua kupenda uyo jirani yako. And remember, you're watching us live on Oracle TV, and this is the best TV station ever. This is a TV that brings you quality programs. And when I say quality programs, make sure that your physical is well taken care of, the current happenings is well taken care of, and of course your health. Like right now we're talking about how important. Najua wanaume mtasema nimeshughulikia wamama sana tangu mwaka ianze. Worry not. I have you in mind. I'll make sure I do something for you, but for you to get your health check, we are here to make sure that you're sorted, to make your spiritual man on point, kuwa sawa uko spiritually. This is the session for you to keep on watching. You can catch us live on Signet, on Pang, tuko pale. And for you to watch us 24/7, you have to partner with us. It is very simple. You go to your pay bill 171133 account is Oracle TV. Trust me, when you do this, ile masaa yote unaamka and you feel like I want to watch Oracle TV, you will get us live. You will see that program that you love. Na kama uko pale unajiambia me I want to partner in a different way, you can purchase our diaries, you can also bring in your advert, you can ile yoyote. And unasema I want to bring a squeeze back, I want my programs to be running, you want mentions, you want interviews the way we are having, ama kuna ile wewe mwenyewe unataka uko pale unataka uojiwe, we can do that for you. Of course, as my producer has projected that diary there in the color that you want. Uko unataka ikuje ikiwa gold, uko unataka ikuje ikiwa orange, unataka blue, unataka ash gray, unataka charcoal gray, wewe ile color unataka, we will surely deliver to you. Wherever you are in this nation, the diary will come to you na ile color ambayo unataka. And once you're doing that, you know, you are making us be on air 24/7, and we will bring you best of the best program, and we will make sure ule ambaye unataka, sisi ni nani, lazima tumlete. And of course, if you want me to bring what kind of a doctor, mmekuwa mmesema na mimi na wadelivia. You started, you wanted somebody to explain about fibroids, mimi ni nani? I'm here making sure that your questions are well taken care of. And of course, wameniuliza swali moja, when should someone see a doctor, or when should it be a concern that right now sasa I need to see a doctor?
First, when you have the heavy bleedings, the bleedings more than 7 days, you have pain during sex, you need to see a doctor.
That is the time that you need to see a doctor. Basa ule mtu mwenye, unajua kuna wale wenye we abstain until marriage, na huyu mtu pia ako hapo, umesema kuna zile zenye hazina science, na yeye hata yeye ashughulikangi. Huyu ako kwa risk gani juu yeye hana nini yoyote, na hata hataki kujua kama hospitali watu wanaenda, na yeye ni wa ku abstain until marriage. Utaambiwa mtu nini gani? Because there are people who I won't say, sitaki kusema ni vile hawajali, this is just out of their ignorance. You find that when the time comes, they find it's a very big problem that they cannot even treat. Na saa hizi venye wako na uwezo, they don't even want to go to the hospital. What will be your advice to them?
Okay, you can just go do a checkup yearly. It's good to know how you are. It's good to know your health. You can't just sit there, unaona uko sawa, alafu hauendi kuangaliwa. It's good just to do a whole body checkup yearly.
Yearly?
Yes.
So kwa hiyo mtu anaenda mara moja?
Just to know how your health is. Yes.
Okay. Make sure that you see a doctor every time. Make the appointments, book the appointments. Na pia kuna ile nye just walking, si lazima ubook appointment pia kwenda kuona ni maisha yako, ni hali yako, and you know, wewe mwenyewe ndio unajua. And kuna ule mtu mwenye una feel pain and you're like, na kuanga tu hivyo. It is, hakuna kitu inafanyika kwa mwili yako kama tu inakuanga hivyo, just go tell the doctor. And what we agreed is when you are going to the doctor, don't tell the doctor that unaficha some information, unasema ile unasema hii itaniaibisha kwa daktari. Don't feel embarrassed when uko kwa daktari. Hata ile unaona ni kama ni upuzi, you just tell them, maybe that will carry the answer that you are seeking for. Unaweza sema niko na fibroids, kumbe ni something different. You just go, let the doctor diagnose you, let the doctor tell you. Tumesema tuachane na Dr. Google kwa sababu Dr. Google will not help you, will just actually increase your anxiety and make sure that uko pale pakunina. Maybe kuna chakula yenye mtu akikula inaweza mfanya hiyo rate ya kupata fibroids ipungue. Tuliuliza ya kuongezea. Kuna yenye ukikula apart from the balanced diet meat, kuna specific foods that you can mention that maybe inaweza fanya mtu asiku hizo chances zipungue.
Mostly vitu ziko na a lot of vitamin D. Yes.
Ndio zitasaidia mtu. And can exercise make the fibroids shrink?
No. X-rays? No.
So wale ambao physical exercise ni tiba kila kitu, si ya kila kitu?
Not really. They can't make the fibroids shrink. Exercise inafanya tu body kwetu sawa, normal.
Na wale wamefika menopause, kuna is it a myth ama ni unasema once you are past menopause you can't get fibroids?
That's true. Yes.
It's actually a fact.
Yeah, you can't get fibroids ukifika menopause cause see I've told you reproductive age tuko na hizo estrogen na progesterone and when ukifika menopause the hormones zinarudi chini. All of them. So hakuna yenye ta support the fibroids. So in fact if you had fibroids ukifika menopause they tend to shrink. That is because we don't have estrogen and progesterone to support the growth of the fibroids. Yes.
And maybe are there specific hospitals that people should go to get checked for fibroids, or any hospital can do that?
Any hospital can do that. Yes. But mostly with the hospital with imaging, because if you yourself you diagnose a fibroid, you need to send this person for an imaging, that is ultrasound, for you to be sure that it's fibroids.
Okay.
Yes.
So any hospital can do that. And maybe what will be your advice to women out there, because we see most women are suffering, and kuna wale wenye kutoka wakiwa wadogo wamekuwa wakiwekewa wasiongee. So huyo mtu anaumia but amenyamaza. But amenyamaza. What will be advice to women out here generally? Okay,
first, you are the one suffering. It's good to be open. You will be helped earlier, because you can just imagine you are out there, you are not pregnant, and your belly is growing. You see, people will start saying, oh, huyu akona mimba, huyu akona mimba. And in really sense, unajua hauna mimba, you will feel very bad. Of which, ungeenda mapema, you open up, usaidiwe mapema, hizo nini hazinge ku-affect. You know, when watu wanakuongelea nyuma, ati ule hana hivi na kona mimba, you feel bad. So when you go early, you will be helped early. Yes.
So early, the best key thing is you appearing early to the doctor, and the doctor will do that. And tumesema fibroids make the belly to bloat ama kuswell. Does it mean that every woman who has bloated is a sign of fibroids?
No.
Are there other causes that cause bloating?
Yes. Even you know, when you say bloating ni ile gas imejaa kwa tumbo. Yes, we have also peptic ulcer can cause bloating. Yes.
Wow, I didn't know that. But make sure when you're around teachers, you're going to health web hospital, and they will help you diagnose a few things, 1, 2, 3, and they'll make sure that you're getting everything. Maybe daktari tukimalizia, what is your final word to women out here, because I believe men don't get don't get fibroids. What is your final word to women?
Okay, my final words, when you feel when you have menstrual pain and they are severe, don't think they are normal. You need to go for a checkup. Yes. When you are having sexual activities, sexual intercourse, you feel pain, you need to see a doctor. It's not normal. Yes.
Wow, thank you so much for gracing our studios today, and thank you for giving information. We totally appreciate. And of course, if you are there and you still have questions, maybe unaona hii swali inaniwasha sana, I wanted to ask about it, be sure to send in on our SMS number, that is 0711 176 006, and also you can call the same number or WhatsApp the same number, and we'll be glad to bring Daktari back and explain much further on the questions that you have. But as we are ending, remember we are partnering with Oracle TV. It's very simple, it's very easy. Paybill number 171133, account is Oracle TV. And once you're doing that, do that with revelation, do that knowing there's a difference that you want to make, because all of us cannot be presenters, all of us cannot bring the doctor here, or all of us cannot be doctors. But when you're doing this, you are also presenting together with me, you're also giving the knowledge together with me, kwa sababu kuna mtu mahali atapata information na aweze kubadilisha maisha yake na kila kitu ibadilike, ama ule mwenye alikuwa na woga ajue how serious the case is, na vile anafaa kuenda hospitali mapema, kwa sababu what I have gathered from the interview of today is the earlier you go to the doctor, the better. So ukienda kwa daktari mapema, udiagnoziwe mapema na itibiwe mapema, uko na high chance of you not. And by the way, daktari, nimekumbuka swali tapoleka umalizia, can it reoccur again after umetolewa? Inaweza rudi tena?
Yeah. When you know, I've told you we do myomectomy. Myomectomy, they only remove the fibroids only. So umetolewa alafu then umekaa tena for a longer time, the uterus is empty. Of course itarudi.
Okay.
Yes.
So the uterus will be busy.
Not so busy kila time, but it's good getting pregnant once. Reduce sana the chances of fibroids.
So maybe for how many years?
I can't tell the span. Inategemea tu.
Okay. So kama umetolewa pia si ati ufurahie sana, chance yako ya kufanya ukue busy. Tumamba ukue busy, but according to how tuliambiwa to multiply, but hawakusema kwa nyumba yako tu. Do it while you're knowing what you are able to take care of them. Of course, thank you for tuning in. Thank you for being together with me. And thank you for sharing the lives. Thank you for commenting. Until next time, I've been your host, Trevilla Lutta. God bless you.